Hello? Great, thank you. All right, we're live streaming this. Very exciting times. Basically, what I'm going to talk about today is intense pulse light, the concept which I developed 20 years ago to FDA approval. But the exciting thing is that we are announcing OptiLight as the newest and FDA approved treatment for dry eye disease. We are live streaming this, so if you're at home, welcome. We are at Escris here in Amsterdam. Got in last night, very excited to be here at the European Society. It's very incredible that we're back to live meetings and that people are coming out and we have a great attendance. So let's get into it. So essentially, I've been at this for 20 years. And kind of where it started, here I am using the first fourth generation IPL system, the M22. And then I'm going to be announcing and showing you how to use the fifth generation IPL system, the OptiLight. The one you see here is the M22, and the one here you see is the OptiLight. So how did this all start? So essentially I had an aesthetics clinic, and in that aesthetics clinic I was using IPL to treat patients with rosacea. And some of those patients, after I treated them, they would come back and state that not only was their face better and their rosacea improved, but also that they felt like their dry eye was improved. So that started me on a long journey of figuring out, is IPL a treatment that you could use for dry eye? So when IPL first came out, what we were using it for were for patients with, let's see here, patients with telangiectasia. So here you see a rosacea patient with that redness and rosacea look of those telangiectasias at the epidermis. And what we were using IPL for when it first came out was to actually try to close those blood vessels so that you could get patients so their skin would look normal. And then what I found is that those patients with meibomian gland dysfunction and rosacea, once we did IPL, that was improved. So the first paper ever published was this case report that I had written on trying to throw out to the ophthalmology community that IPL could actually be used. So one of the things that you see here is this treatment, and we would treat patients from ear to ear to improve their meibomian gland dysfunction. Now, most dry eye patients have MGD, so 86% of patients with dry eye disease have meibomian gland dysfunction. And rosacea patients, about 80% of rosacea patients have meibomian gland dysfunction. So that's why rosacea was a great way to start this treatment, because there's so many of them that have dry eye disease. So what we're trying to do is, in meibomian gland dysfunction, is you have these glands. I tell patients that and doctors that these glands are like a test tube. So what happens is they're lined with cells that are producing a meibum, and usually that meibum is more like an olive oil-like secretion. These patients with meibomian gland dysfunction are producing more of a toothpaste-like secretion, so these meibomian glands are getting filled with toothpaste, so they're not getting their natural oil. So a tear is made up of water, protein, and oil. If you don't have your natural oil, your tear will evaporate very quickly. You have about 20 to 30 of these meibomian glands in the lower and upper lid, and these patients with meibomian gland dysfunction have clogging of these meibomian glands due to these toothpaste-like secretions that are making. In these rosacea patients, which were the first patients that I was treating for meibomian gland dysfunction with IPL, they have a bunch of inflammatory mediators that they're making on their skin. It turns out that two of the most important inflammatory mediators and most specific for dry eye are interleukin-17 and interleukin-6. And as you can see here, these patients with rosacea are producing this interleukin-17 on the skin. And what we're also seeing is that they're producing interleukin-17 on their tear film. So one of the early papers that we wrote that was published in the American Journal of Ophthalmology, we showed that we can actually decrease the amount of interleukin-17 on the tear film by treating these patients with intense pulse light. So the other thing that we've shown over time is that in these rosacea patients, they're producing this interleukin-17, and we're actually decreasing the amount of interleukin-17 on their skin. So these are two mechanisms of action in terms of how IPL helps these dry eye patients. All right, so what is IPL? So IPL isn't a laser, it's actually a xenon flash lamp. If you remember your chemistry, xenon is one of the stable gases, one of the noble gases. So it has the exact number of electrons that you need on the outer shell to make it very stable. So what we do is we take the xenon gas, we put it in a bulb, we throw electricity through it. That causes instability in the gas, but since it's a stable gas, when it gets back to stability after that electrical charge, it emits a light. That light is anywhere from 400 nanometers all the way up to 800, 900 nanometers. So what we're doing is we're putting a special filter on that light to block the wavelengths of light that we don't want. So what we've found with research is the light that we want in terms of stimulating the meibomian glands to work better is nanometers from 600 all the way to 700. So basically red light is what we're looking for in terms of stimulating the meibomian glands. As you can see here, at that 600 nanometers, that light is absorbed by a few things. One of the things it's absorbed by is oxyhemoglobin. And then when we're talking about the thinnest skin of the face, we don't want to give them all of that energy all at once. So what we want to do is pulse that energy so we have some thermal relaxation time. So essentially one of the advances that Lumenis made was being able to pulse this energy so that we don't give it all at once. So you'll see a multiple pulse IPL system when you're looking at the Lumenis system. And then we have the ability to change the energy levels anywhere from 10 joules all the way up. What we've found with our research is basically 10 to 16 joules is the amount of energy that we want. Now, some people always think, well, the more energy, the better, but it actually doesn't work that way. You want a specific amount of energy delivered to the meibomian glands so that you don't have any adverse events to the meibomian glands, but you actually stimulate. So when we're talking about IPL for meibomian gland dysfunction, more isn't better. So why these wavelengths are important, so one mechanism of action is that with this wavelength of light in that 600, in that red range, that light can penetrate the epidermis, go to the dermal layer, be recognized by oxyhemoglobin, and when it's recognized by oxyhemoglobin, it causes a coagulation in that telangiectasia, and it closes off the telangiectasia. Now, one thing that you have to keep in mind is that same wavelength of 600 in that red range is recognized by pigment in the skin. So that's why you have to be very careful in patients who have darker skin, because these wavelengths are actually absorbed by pigment. So when you're talking about patients who have Fitzpatrick 4 or 5 or 6, you have to start changing your energy levels and changing your thermal relaxation time so that these patients can have IPL and not have any adverse events. So what's great about the Lumenis system is actually you have the ability to change the milliseconds of energy that you're delivering, but you also have the ability to change the milliseconds of thermal relaxation time. And I'm going to demonstrate that in a few minutes here. Another mechanism of action is actually IPL kills microorganisms. So right now in the US, I'm not sure if this is being done in Europe, but we actually have IPL machines that are disinfecting hospitals, disinfecting ORs. So essentially what you have is this Xenex robot, which is an IPL machine that's pushed into a room, closed, and then it emits this intense pulse light throughout the room, killing microorganisms. So why is that important when you're talking about dry eye? It's important because right there at the lid margin, you can have an overgrowth of bacteria in dry eye patients. You can also have an overgrowth of Demodex. So essentially, IPL will actually decrease this overgrowth of bacteria and kill Demodex. So we're actually working with a Chinese ophthalmologist, Dr. Chen, who we're showing that, and these are the Demodex. You actually show a patient these little mites, these parasites that live on their lid margin. They get really grossed out and they say, please get rid of these. But each one of these carry about 6 to 8 eggs, so they can multiply very quickly. So what IPL will do is with this flash of light, you can actually kill these microorganisms. So another mechanism of action for why IPL works is that it decreases the amount of Demodex on the lid margin. What I think is the biggest reason why intense pulse light works for the treatment of dry eye is actually these wavelengths of light actually stimulate the mitochondria of the meibum cells. So what is photobiomodulation? Photobiomodulation is using light to actually upregulate mitochondria so cells work better. So in this wavelength of intense pulse light of 600 to 700 in this red light, you're actually stimulating the cells to work better. So photobiomodulation is used in a lot of different areas of medicine. So in retina, they're using infrared to help age-related macular degeneration patients. In aesthetics, they use red light to stimulate fibroblasts to make collagen. In orthopedics, they're using infrared to help muscle and bone heal. And then what we're using red light for and intense pulse light for is to stimulate the meibomian cells. So what you're going to see when I'm presenting some of the FDA results is actually intense pulse light actually will stimulate meibomian glands to come back. So I've been doing a lot of meibography showing that basically these dropped out glands that you see in meibomian gland dysfunction can be brought back with intense pulse light. Now this is an interesting patient because this is a patient that actually had meibomian gland probing. So these dark spots represent dried blood from probing where somebody probed, and as you can see, these meibomian glands are actually abnormal. You can actually transect the meibomian gland, injure the meibomian gland, cause this kind of blood clotting around the meibomian gland and scarring. So what I tell doctors is I would not do meibomian gland probing because you can actually injure the gland, so not even IPL can bring those glands back. So one thing that we're doing is we're generating heat in the dermis, so actually the meibomian gland actually can open up and we can actually start melting this toothpaste-like secretion. So another mechanism of action is I actually do expression after each treatment of OptiLight and IPL so that we can actually get this toothpaste-like secretion out of the gland. So this is a patient with severe meibomian gland dysfunction, and as you can see, they're not making olive oil, they're making this thick toothpaste-like secretion, and what we're trying to do is get that out. So where that is helpful for the patient is that you've opened up the gland, and now if there's any normal cells in that meibomian gland that are working, now they can start releasing normal meibum to actually add some oil to their tear film. So this is what I would call severe meibomian gland dysfunction. And all I'm doing is I'm just pressing and holding and letting all of that meibum come out. Why that's important, the physics of meibomian gland expression is that you want to keep pressure on, so you increase the shear stress, so you lower the viscosity of this toothpaste-like secretion so that you can get more out. So this is severe. Once you start doing some IPLs, what will happen is this secretion will get more, instead of like toothpaste, it'll get more like butter. So instead of this white, thick secretion, you'll have more of a butter, softer viscosity like secretion. So this is a patient that's already had a couple of treatments of OptiLight. And then what do we see on the lid margin? These patients with meibomian gland dysfunction and dry eye disease, this is a typical lid margin. You'll see that they'll start losing their eyelashes because they're not producing normal meibum. You'll see scurf and collarettes. These are signs of Demodex and blepharitis. You'll see these small little telangiectasias coming to the meibomian gland. You'll basically see a shutdown. You don't see any openings of meibomian glands here. You'll see a thickening of the lid margin. And then after a couple of treatments of IPL, you'll see the closing down of those telangiectasias. So you don't see those telangiectasias anymore, and now you can see some openings of the meibomian glands secreting oil. Look at the eyelashes. The eyelashes are coming back, and they're nice and clean. We don't see any signs of collarettes, which are signs of Demodex, and we don't see any overgrowth of bacteria. The lid margin is much cleaner. So when we're looking at all the mechanisms of action for OptiLight, it kills bacteria and Demodex. There's the heat and expression, closes off abnormal telangiectasias, decreases inflammatory mediators on the eye and the skin, and photobiomodulation. Another reason why this treatment works, so it works at the cellular level in terms of stimulating mitochondria, but it also works at the DNA level. So when you apply heat to cells and you don't destroy cells, the way cells protect themselves is the DNA will produce heat shock proteins. The most studied heat shock protein is HSB70. So what those heat shock proteins do is they aid the DNA in translation. So essentially what you're doing is you're effectively making the DNA of these cells better. So not only are you making the mitochondria upregulate and work better, but you're making the DNA of these cells work better with these heat shock proteins. And it turns out that heat shock proteins are produced when you treat patients with intense pulse light and OptiLight. So there's been several papers written about IPL for MGD. Lumenis had the first 4th generation IPL system, and the things that make it a 4th generation IPL system is that you have consistent energy levels. So if you program 12 joules, what the IPL system will produce is 12 joules. A lot of IPL systems, what happens is the more you use them, the less effective they are because they're not producing what you're programming because the energy levels are going down. So for example, in a 1st generation IPL system, if you program 12 joules, the first time you use it, it'll give you 12 joules, but after 2 or 3 months of using that IPL system, when you program 12 joules, it'll only give you 11, and then 10, and then 9, and then 8. So by the time you treat somebody for a few months, or by the time you're using this system for a few months, it becomes an ineffective system because it's not giving you the energy levels that you're programming. So that's one thing, one of the advances with the Lumenis system. Then equal distribution of energy. So when we're programming these IPL systems and we're saying we're going to give you 6 milliseconds of energy, in that 6 milliseconds of energy, you want a consistent energy. So you don't want the first millisecond of energy to be, let's say, 10 joules, and then the third millisecond of energy to be 9, and a decrease in energy. And that's what happens in first generation IPL systems. So we're getting an equal flat top distribution of energy throughout that pulse. Then one of the problems with the early generation IPL systems is the heat that's generated at the tip will actually burn epidermis. So what happens is if you don't have a chiller on the plate of the IPL system, you will burn epidermis, and then it takes 4 to 6 weeks for that epidermis to heal. So you have to wait a long period of time in between treatments. With the chiller plate, you're not burning epidermis, so that's why I'm able to treat patients every 2 weeks instead of waiting 4 to 6 weeks in between treatments. And the shortest amount of time that I've waited, or shortest amount of time that I've done in between treatments is 1 week. And the only way that I'm able to do that is that we have that chiller plate, and the cells and the skin can recover very quickly. And then finally, what I was talking about before, the ability to control the energy, the thermal relaxation time, and the energy time that we're giving. And why is that really important is that it allows me to treat Fitzpatrick type 4, 5, and 6. So patients with darker skin now can have IPL treatments for their meibomian gland dysfunction. So that is the 4th generation system. I think we have one, maybe I don't see one here, but now we have OptiLight. So what are the advantages of the newest generation IPL system, Lumenis OptiLight? So I've been conducting studies for years to be able to treat the lid margins, and essentially what we needed is a very small tip to be able to do that. So if you look at a paper that I published 3 years ago, I showed with a very small tip that we can essentially treat the upper lid. That becomes very important in terms of patients with really severe meibomian gland dysfunction, where we want to get energy to the lid margins so that we get more efficacy. So that smaller tip was developed so that we can actually get in places where you're not able to get with a normal IPL system. So what I'm going to demonstrate is this small IPL tip that we're using for dry eyes. That also becomes important when you're talking about treating a chalazion. So if a patient has a hordeolum or a chalazion and you just want to do a spot treatment, with this small tip you can go ahead and do a spot treatment right to that lid margin. And then it has all the advantages of the M22, where you have triple pulse, consistent energy, a chiller tip, and the ability to change the filters. All right, the FDA study. Everybody wants to know about the FDA study. So essentially what we did in the FDA study is we did a sham treatment with a non-IPL light, and then we did IPL. So one group was sham IPL with expression versus IPL and expression. 90-something% of the patients had the Toyos parameter and protocol. All triple pulse, 6 milliseconds on, 50 milliseconds thermal relaxation time, energy levels between 10 to 16 joules, Fitzpatrick skin type 1 to 4. We had 88 patients in this study. So the first thing that we showed is that we had clinically significant improvement in tear breakup time between the sham and the IPL system. But what you'll notice is that even in the sham treatment, we did have some increase in tear breakup time. So what does that tell you? It tells you that expression is important. So if you're going to do IPL, I recommend, and the FDA study is showing this, you should express these patients after every treatment. It will just make them better. And then we looked at the OSDI scale for these patients, and this is a questionnaire. If you're not familiar with OSDI, this is a questionnaire showing how they're improving with their signs and symptoms and evaluating their dry eye symptomatically. And what we showed is a clinically significant increase in OSDI, and as you can see, also we showed that just the sham with expression, there was some improvement in OSDI scores. So again, you should express these patients after every treatment. But what I think is really significant is improvement in the glands. And here where we compare sham to IPL, we see that here clinically significant improvement in meibomian glands that were dormant or not working or not expressible. So this is where we're showing photobiomodulation is actually one of the mechanisms of action in treating these patients with meibomian gland dysfunction, that these wavelengths and these energy levels are actually stimulating the cells to work better. So that's why we see patients where we do meibography and they have dropped out glands, and we do several treatments of IPL, that these glands come back. So this supports photobiomodulation. So express, and there's plenty of studies showing that actually expression is very important in terms of treating patients with dry eye disease. So whether you do IPL or don't do IPL, expression should be part of your normal routine in treating these dry eye patients. So I hold the patent for light treatments for dry eye disease and meibomian gland dysfunction. One of my patents is the use of low-level light treatment for the improvement of meibomian gland dysfunction. And so what you're going to be hearing about over the course of the next few years is people talking about low-level light treatment. I actually spent over 10 years studying low-level light, and I can tell you what works and what doesn't work. So we tried face masks for patients to see if that would actually improve meibomian gland dysfunction. But essentially, those wavelengths of light as a face mask and not touching the skin doesn't improve meibomian gland dysfunction. So think about this. If that would actually work, then we wouldn't actually have to do IPL right on the skin. We could just go away from the skin and treat them with these wavelengths of light. And we can't do that. It doesn't work. Same with low-level light treatment. What we found is we have to be on the skin when we're treating these patients. So this was the first low-level light system that I made in my home. I just took some parts, some LED, and we started working with it. Then what I did is I created a LED system that had blue light, infrared, and red. So I tried different combinations. I tried solo. I tried red with infrared. I tried red with blue. And what we found is red and blue work to stimulate the meibomian glands to work better. But again, you have to treat right on the skin. So here are two of my inventions. This is a blue light cue, and this is a red light cue. Again, you have to treat right on the skin. What we do is we use the blue light cue for patients to use at home because it's safer energy to use at home. I don't have to worry about if the patients use it too often. And then we have red light, which is a lot more energy. And you do need supervision when you use the red light because patients could get in trouble. So again, we use the blue light for at-home low-level light treatment and red light for in-office. Now, the question is, what's the difference between IPL and LED, low-level light treatment? And it's a question of energy. So the number of joules that you're giving a patient with an IPL system or the OptiLight is anywhere from 10 joules to 16 joules, When you're using a low-level light treatment, we're really only doing 1 to 3 joules of energy. So it's very, like it says, low-level light treatment. So it's used more as maintenance rather than actually a treatment. So if you have somebody with moderate to severe meibomian gland dysfunction, you're not going to be able to treat that with low-level light treatment. Another question that comes up, and this is the way I'm going to describe it, doing IP with the patient in the office, doing IPL, and then right after doing low-level light treatment. That's very silly. Basically, you have a system that's giving them 10 to 16 joules, and then right after you're just adding 1 joule, 2 joules of energy. So that would be like me jumping in the ocean, getting out of the ocean completely wet, and then somebody throwing a glass of water at me. I'm already wet. The energy's already there when you do an IPL system. Giving them a little bit more energy with a low-level light treatment is not going to add to the effect of what you're doing with IPL. So those two don't work. So if you see people who are touting the face mask for low-level light treatment, that's actually used in aesthetics to stimulate the epidermis to make stimulate the fibroblasts to make collagen and elastin. It's not going to penetrate deep enough to do anything with the meibomian glands. So before I do a demonstration on the OptiLight, best way to get a hold of me is text. So you can text me your questions. Also, we have clinics in Memphis, Nashville, but we have a clinic in New York City. So we have a lot of European doctors that fly to our clinic in New York City and watch me do dry eye treatments. We do that on a Saturday so that you can come and see that and get trained on the OptiLight or get trained on everything that we're doing. So I'm going to talk to my cameraman. We're going to walk over here and I'm going to walk through the OptiLight system. So here we are with the OptiLight, and so you have two basic hand pieces here. So you've got the one, which we're going to demonstrate first, this is like a little pencil tip so that you can get to certain areas where you weren't able to get to. So we're going to start with that. So you have a little disposable tip here. Luckily, I have big hands to be able to hold all this at once. So this is a little disposable tip that you can put on the handpiece, and then you put that on. So that's disposable. So after every patient, in the world of COVID, you can take this off and put a new one on. Patients are very aware of clean protocols. Then you click this on, and let's see if we have there's a little dongle here that when we click, and then we're going to pick a skin type. So our lovely assistant here, let's call her a skin type 3 and then this has my parameters and protocol. So if you look at the paper that I published on, let's just talk upper lid, basically I was using about 10 joules. So we'll put 10 joules here, and then you press ready. And then there's a little beep that you didn't hear. We're not going to really give her a treatment. So then you would come here, close your eyes for me. If you wanted to do lids, you would take a little bit of ultrasound gel. And let's see if we have do we have some ultrasound gel here? A little ultrasound gel. So what I would do is I would put some ultrasound gel on the lids, and then we would go ahead and treat here. Now, the other thing that we would do is we would have something to actually block out the eyelashes. So we'd use a little eye shield, because IPL can be used for hair removal. So if you get IPL onto the eyelashes, that could actually take away the eyelashes. So let's just pretend, I'm doing a lot of pretend here, but live TV, you gotta work with it. So I would put like an eye shield right there, blocking the eyelashes, and then I would go ahead and treat. So I'm just going to show you. I'm going to shoot this out into the world here, and yes, and live TV here. Let's get this going. Turn on the OPT hand, press trigger. Okay. All right, so you're going to see a little light treatment. Go ahead and keep your eyes closed. So there you see it. So, you know, the human eye, it's difficult to see the pulses, but this is actually multi-pulsing. So you can see that it's not just giving you one burst of energy, it's actually pulsing. So what that pulse is that you're getting milliseconds of energy, then you're getting some thermal relaxation time, meaning that there's no energy being transmitted to give the skin some time to absorb the energy that you gave it, and then another bit of energy and another bit of energy. And again, these are my parameters and protocols. So that's one way to treat the upper lid. Now, if you want to treat the lower lid, you could do the same thing. I'm coming back to you. You're going to get touched here in a second. You can come back with this pen and treat the lower lid. So that's one way to treat upper and lower. Or you can now switch this from using the pen to using the bigger handpiece here. So I would unlock this. I would take this out. I would come here. I would put this other handpiece on. I'd close that. And now we have this OPT filter, so we're going to take that filter out. And we're going to put a 590 filter here. We're going to switch this, and we still have the same skin parameters. And let's see here. Okay, in order to use, please change the filter. All right, so let's go to, again, live TV here. Instead of the 590 filter, it's asking me to put this rosacea filter, which is fine. It's still a 590 filter. When you get this system, you'll be able to program in your own parameters, and what you could do is you could come to here, IPL, and it's doing a self-test. And you could program, so this is what I do at home. I've programmed my settings, and you can program your own dry eye settings, and we'll give you those settings when you get it. But let's just, so that we can move on. And so saying 18 joules, so I basically live between 10 and 16 joules. So a Fitzpatrick type 1 would probably get 14 to 16 joules. A Fitzpatrick type 2, 14 to 13. A Fitzpatrick type 3, they're going to get about 12 joules. A Fitzpatrick type 4 and above, I do 10 joules. And then if I get into darker skin, a Fitzpatrick type 5 or 6, how you're going to adjust the energy here is the lowest energy you want to give people is about 10 joules for effectiveness. What I would do is I would increase the thermal relaxation time in patients who have a Fitzpatrick darker than myself Fitzpatrick 5 or 6. All right, so now with this bigger head, and before we press ready, so you could use the pen for the upper lid, but now you could use this bigger foot plate to do the lower lid here and here. So essentially you could do upper lid with the pencil tip, treat, 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 put this away, and then do kind of the standard treatment. You're going ear to ear, and then treating here. And again, you would have some type of shield covering those eyelashes so that you don't have any problems. The only time you'll get in trouble with IPL is if you were to shine intense pulse light onto an open eye. So as long as that lid is closed, you will not have any penetration of light past the subcutaneous layer. So that's very important. And then covering the eyelashes, that's very important too, because the IPL can recognize the hair and actually take away hair. So that's two ways of using that you could use your IPL system. And again, you can program all of this in. What's great about the Aesthetics OptiLight is that not only can you treat dry eye, but you can treat patients with rosacea, you can treat pigmented spots, you can treat acne, and all of that you can actually program in, or you could use the settings that come from the factory that are already preset for you. So there's a lot of things that you can do with this intense pulse light system in your clinic. So in our clinic we have aesthetics and dry eye and ophthalmology. So I mainly use this treatment for dry eye, and then my wife, who's oculoplastics, she uses this system for aesthetics, using it for acne, for rosacea, for facial rejuvenation. So very adaptable to whatever you want to use this IPL system for. And then the final thing that I would say is if you have somebody with a hordeolum or a chalazion, what's great about this tip is if they have a little chalazion on the upper lid, you can just treat directly onto the chalazion, or if they have it on the lower lid, you can come here and treat right onto the chalazion, which is nice. So you don't want to give them a whole dry eye treatment, you just want to do a spot treatment on their bump. You can just do that with this little pencil tip. So this is a incredible advance in treatment of dry eye. Instead of relying on drops or other medications, you can actually treat the root cause of dry eye, which is their meibomian gland dysfunction. A lot of patients don't like using drops. Some of the drops don't work. And then when you're talking about patients that have moderate to severe meibomian gland dysfunction, drops really don't do the trick. And this is the only system that is approved by the FDA for the specific use of dry eye disease. And then finally, the last thing that I will say, if you're talking about low-level light treatment, the only low-level light treatment that's been proven to work and that has a patent is my low-level light treatment. A face mask will not really do the trick, and combining IPL with a face mask for low-level light treatment is really kind of absurd. So that is my presentation. Is there any questions? Sure. I feel like a talk show host. Hello, welcome to Escris. What is your question?
You said that for some phototypes you could change the relaxation time. How do you do that?
So you would come here and, excuse me here, you would come here to the home and we would go, see, I don't think, you're going to have to believe me on this, but this is just one of the factory models. But you would come to the system, you would turn on IPL, and then you would look at your parameters. I wouldn't change the energy level of 6 milliseconds, but you can come to the thermal relaxation and go from 50 milliseconds, and you can turn it all the way up to 150 milliseconds. So say, for example, you have somebody who's Fitzpatrick type 5. You try the normal parameters at 10 joules, but they're like, it shouldn't hurt. So you do your test spot here, right at the ear, and if they kind of jump back and they say it's too much energy, then you can increase the thermal relaxation time to 100 milliseconds. So it's going to be 6 milliseconds, 100 milliseconds, 6 milliseconds, 100 milliseconds, 6 milliseconds. So 6 milliseconds of energy, 100 milliseconds of thermal relaxation time. Then you try that, and then they say that's too much, then you can actually increase to 150 milliseconds of thermal relaxation time. And if they can't handle that, then it's too much energy for them, and then you're going to have to, say, I can't treat you. But what we're finding is that you can treat those patients, and they can tolerate that much energy level as long as you increase the thermal relaxation time. So another example of when I do that is if you have a young child. So now we're getting younger and younger people with meibomian gland dysfunction. So if you have like a 10-year-old that you want to treat with IPL, you lower the energy to 10 joules, doesn't matter their skin type, because again, they're kids, they're scared, and then you increase the thermal relaxation time all the way to 100 milliseconds, and then you give them the treatment. Because in younger people, it doesn't take much energy to stimulate the meibomian glands to work better. So the older the patient, the more energy that they're going to need to stimulate the glands. The younger the patient, the less energy that you're going to need. Their cells are more vibrant, and they could respond a lot better. You're welcome. Any other questions? Or I'm going to start singing. Okay, yeah, okay, we got...
Do you ever use corneal shields when you have a collision?
Okay, so that's the big question. So corneal shields. So for years we tried metal shields, we tried plastic shields. There's two things that are a problem. One is when you put a shield on, now you're stretching that skin out. And the question is, are you going to get the same efficacy with the meibomian glands stretched out? And we found that you don't. The other thing is the shields can be irritating to patients. So a lot of patients after IPL wearing corneal shields, they would have a conjunctivitis that we would have to treat. So it was actually a little bit counterproductive to what we were doing. So really, in the energy that you're producing is not going through the dermis. It's not going past the dermis. But patients do sense some light when you're treating that area. So the best thing would be to create kind of a contact lens that would block out the light, just so that they're not getting photosensitive to the retina and not getting light to the retina. So that's something that maybe in the future you might see. But you don't need metal or corneal or plastic or any kind of corneal shield to do these treatments. And if you look at the study that we produced for upper lids, those patients did not get any shields and there was no adverse events. Like where? What? Oh, okay. Do you want me to pose?
Can you grab a bit higher because we have a mic like this, then we hear some.
Oh, okay. All right. A little higher. Another question?
Could a patient use your Q without prior IPL treatment? What would you say?
Not really. Low-level light treatment will help somebody that has mild meibomian gland dysfunction, but it won't help anybody that has moderate to severe. So if they're making toothpaste-like secretions, that's too low of energy to do anything. So really what I'm using low-level light treatment for is maintenance after IPL. So I have patients that will come in and say, can I start using the Q, start using low-level light treatment? I'll say, you're not ready. So I usually have to get these glands working much better for low-level light to do anything. It's just too low of energy. But it's great at maintaining the meibomian gland functioning for longer so that it will prevent them from having to do maintenance treatments too many times. So for example, after IPL, you're going to still do maintenance treatments. So patients will come in, 6 months or 3 months or a year to get a maintenance IPL. So after the 4 treatment protocol, they'll come in to get 1 treatment of IPL to keep these glands working. If you're using the Q at home, that actually pushes out the time that they have to get their maintenance treatment. So for example, if somebody's getting a maintenance treatment every 3 months, if they're using the Q at home, that might push it out to 4 months or 6 months. Then another thing is, there's patients that have what I call small opening syndrome, SOS syndrome, where their opening to their gland is so small that it's trapping some of the meibum from coming out. What the Q, low-level light treatment, does at home is it actually opens up that gland so that you can get some flow. So it's a great treatment for small opening syndrome. Any other questions? Yeah.
Either calcium you treat in acute or in chronic calcium, or both?
So this is a good question. And so if you have somebody that has a chalazion that's scarred down, IPL is not going to do anything to that scar. It's not going to make the scar go away. But you will be surprised that somebody that has a chalazion for like 3 months or 4 months, where you think that it's scarred, I would try IPL anyway, because sometimes it's not scarred and the IPL can actually reverse the chalazion. So works really well with hordeolums. It may work with chalazions. If it's a scarred chalazion, then it's not going to do anything to take away that scar.
Regarding the expression, you do only in the lower or also in the upper, and also which therapy you give after the expression, if you can.
So another great question. So do I express after every IPL treatment, and I actually express lower and upper lids, whether I treat the upper lids or not. In the FDA study, we weren't treating upper lids. We were actually just treating right here below the lids. And we still do expression. So what you'll find with IPL is wherever you're putting that energy wave is actually moving. So if you're treating the lower lid, some of that energy is going to the upper lid. So that's why you saw in the FDA study, not only were the lower lids working better, the upper lids were working better, and we weren't even treating the upper lids. So if you don't treat upper lids with IPL, you're still going to get improvement in the upper lids by giving energy to the lower lid with the eye closed, because that energy travels up. One of the reasons to do a small tip on upper lids is the orbital ridge prevents a lot of the energy from doing a wave away from the spot that you're treating. So if you're using a big tip, like say you're using this tip, really there's no room for that energy to escape anywhere. So it gets trapped by the orbital rim right on the upper lid. And so I express every time, and I express upper and lower lids. So I think Oculus is here. Oculus is, I've worked with Oculus to invent a little expressor, disposable expressor with a silicone tip. And it's called the Oculus Lid Stick. So that's something that you can look at. Any other questions? Or I'll start singing. Any other questions?
With the new machine, you don't use any more glasses protection? Or?
So I don't wear glasses when I'm treating patients with IPL. One good thing is that if you look, the footprint is here, and you're actually blocking a lot of the direct light. So I actually I put it where I'm going to treat, and then when I press the button, I'm actually closing my eyes. I think the eyeglasses for me don't allow me to see as well as I can without. And again, I've been doing this for over 20 years, and I've never had any problems doing it that way. But I think when you start out, wear some glasses just to block out some of that light, and then once you get comfortable using the hand shield, using this, either this button, or you can use this button over here if you're using the treatment like that. Once you get used to using it, then I think you'll be fine to not wear the glasses. But if you have anybody around you, like if the patient wants to bring a loved one in to see the procedure, I would have the loved one wear glasses for sure. Hello, Liz. Welcome. You want to come in, and we're live streaming. You don't want to show your face? There you go. There. There's Liz and B, who've been with me. They're always around. They're very shy too, but they're from Lumenis. Thought you were going to get off the hook, huh? But they look great. You look great. You look awake and good and ready to go. Yeah, and look, they've had IPL, so they're looking good. So one of the things, and not all joking aside, is that IPL is used for facial rejuvenation. So what I've found in my IPL patients is they're getting IPL for dry eye, but what you'll see is that their skin is actually maintaining a nice youthful appearance because the IPL is providing some facial rejuvenation. So that's, again, there's things that you can use IPL for. You can use it for dry eye. It's FDA, the Lumenis OptiLight's approved for that. But actually it can be used for facial rejuvenation. It could be used for acne. It could be used for hair removal. So there's a lot of different things that you can use the IPL for. Well, I think that is going to do it. Thanks for coming on to our live stream if you're out there in internet land. And I will see you tomorrow. I'm going to be giving this presentation again here at Ascaris. It's wonderful to be here back at live events. So thanks a lot, and peace, and stay